Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And today I could not be more thrilled to welcome Dr. Gizelka David-West and to welcome back Dr. Adrienne Towsen. Thanks for joining us today, Gizelka and Adrienne.
My pleasure.
Thanks for having us.
You're welcome. And by way of a very brief introduction, Dr. Gizelka David-West is lead singer of the band N.E.D, No Evidence of Disease, and she's also a gynecology oncologist and my surgeon. And Dr. Adrienne Towsen is an international ballroom dancer, orthopedic surgeon who recently stepped away from clinical practice, which we all hope is temporary. And we'll get a little more into that. And today we'll be talking about how we're recording this episode in September, which is Ovarian Cancer Awareness Month. And Dr. David-West Band is breaking the silence surrounding gynecological cancers, conditions that some women still hesitate to mention. And she'll share how she's raising her voice both inside and outside the operating room. And Dr. Adrienne Towsen will share lessons she's learned from ballroom dancing that are helping to shape her path forward in medicine. And I would like to start by asking what you'd like our audience to know most about you. And Adrienne, I've had you on before, so maybe a little update. What would you like to share today?
Sure. Well, again, so happy to be back. So happy to be here again. And just wanted to, you mentioned that I kind of stepped away. So I've been a practicing orthopedic surgeon for 21 years in my community. I'm in Westchester, Pennsylvania, not far from Philadelphia. And I did recently step away about 4 months ago from my group because we went through a private equity acquisition and our situation just got to a point where it was pretty unsustainable for me personally and some of the other docs as well. So, but I do want everyone to know that I've kind of been channeling my energy into some advocacy work and really want to, make a change and try to get rid of some of this significant corporate influence in medicine and really restore physician independence and the physician-patient relationship. So I've made tremendous connections in large part through LinkedIn, including yourself and many others. And I feel like I'm in it with a great network of people that are like-minded and really pushing for this change. So I've really been spending a lot of time working on that.
Well, thank you for sharing that. And you really have become a powerful voice on LinkedIn. And I love the way that we're going to find out what's next.
Yeah, yeah.
So, Gizelka, what would you like to share?
Thanks so much, Kim, for the wonderful introduction. As you mentioned, I am Gizelka David-West. I'm a GYN oncologist or gynecologic oncologist. I'm with Northwell Health System in Westchester, New York. I thought that was interesting.
Oh,
We're
another
both in Westchester,
Yeah.
but two different states. So my practice is based in Westchester. It's a large health system that I'm a part of, but I am the GYN oncologist for the region that I serve. I practice out of two hospitals. It's very fulfilling. It's incredible. I have a great collaborative effort with the teams that I work with. I collaborate with medical oncology, surgical oncology, colorectal, general gynecology. So it's really for me, I've kind of set up a really incredible practice that I feel very fulfilled and it's very patient-centered and very clinically oriented. So I'm so far enjoying what I'm doing and where I am, and I'm grateful for that. As we mentioned, I am a lead singer of the band N.E.D, No Evidence of Disease. It's a great passion of mine. Fun fact for me is I grew up doing music in the arts. That was a big part of my upbringing. And so to be able to now fulfill both passions, medicine and music, and still have this lifelong engagement in that is really wonderful. And I hope to encourage others to do the same.
Yes, well, thank you. And I think you've both shared through different channels how what you do outside of medicine helps fill your cup and make it more sustainable to continue in medicine. So, Adrienne, last time I had you on, we talked about, surgery is more than fixing bones and, and things like that. We didn't so much talk about the ballroom dancing. So, if you would
Right.
like to share, just a powerful story related to your journey with that.
Yeah, sure, absolutely. So, I was not a dancer growing up. Like a lot of people are surprised by that and think, I should have been dancing since I was a kid, but I wasn't. I played other sports and was always interested in, and I was always an athlete. But ballroom dancing came into my life about 7.5 years ago. So, I was a single mom. I had both my kids during residency. I have two daughters who are now young adults, 25 and 23. So I had really devoted the majority of my life to work and raising my daughters, which was great, which was just exactly what I wanted to do. But then I kind of saw the writing on the wall as they were getting older, like high school years, that there was going to be a void once they went off to college. And I was thinking I would want something else to balance work because, of course, working as an orthopedic surgeon, very long days, busy hours, and my balance was really my kids, and that's what I did for many, many years. And so we had always been fans of watching the show Dancing with the Stars. Like we literally watched it from its very first season. And I wasn't even sure it was I had no idea it would take off like it did. We're like, this is kind of interesting. So me and my mom and my two girls would watch it like nonstop and we got super into it. And so I just loved it and just loved watching it. And then we went to some of the live performances that they do and like met some of the pros and like all that stuff. And so got super into it. So then I was like, well, maybe I'd like to do that. Like maybe I'd like to learn how to dance. And so I ended up going to a dance studio that was just pretty close to where I worked. One of my partners and his wife used to take lessons there just for social dancing. And I had no idea you could do competitions and things like I do now. So in January of 2018 is when I officially started. And I met my teacher who is Italian and he was here on a work visa at the time. So I learned about competitions. I watched one, and some of the other students there were really into it. So I was like, wow, this is cool. And like, maybe I would like to do this. And so we started in January, and by April, I did my first competition. And I was hooked. I was like, this is amazing. It was way out of my comfort zone. So, the ballroom and the dresses and the hair and the makeup, far different than my orthopedic OR. So it was the first time I had really kind of stepped out of my comfort zone. I was 46 when I started. And so it was a big change. And it really then taught me about like, doing something different, kind of humbling, like challenging and sticking with it because it definitely takes a lot of consistency, in order to improve. And so, fast forward, we've been dancing together for 7.5 years now. And it became international because my teacher returned to Italy. So during COVID and stayed. So we have another like interesting part of our story is that we do this long distance relationship. But what I will say is, having that as like a passion, it became a passion very quickly. And then having that really balanced my life so much better. And, even though I was still busy with work, it definitely gave me something else and something completely different, which was kind of cool too, to focus on. And I think had I not had that, especially as I went through some stuff in just the past couple years with private equity and whatnot, I think I would have been much worse off. I think, the stress and everything that came through work, I don't know if I would have had any place to like put that, so having my dance lessons and traveling to dance, really helped.
Well, I love that story, and we got to meet in person last December. I spent some time with Dr. Gretchen Rickards at Longwood Gardens, and then you met us after dinner.
Yeah.
And a few days later, I was in the operating room with Gizelka here. So that's, I think, what made me think, because I had just met Adrienne and I knew what you did. And that, I think, is what gave me the idea to have you on together. So, Gizelka, share a little more about your story.
Yeah, of course. No, I can echo so much of what Adrienne said. It's ultimately it is about having an outlet.
Yeah.
And creative outlet is really the key. Medicine, surgery, being surgeons, it is very hard. It's a hard job to do. Taking care of people, taking care of your patients, walking the walk with them, living the life with them. If good outcomes, bad outcomes, you're so invested and so committed, and so much of you is put towards that. Then you kind of have to step back and say, well, what about me? What am I doing for myself? What's keeping me whole? And I really think I was so fortunate to join N.E.D. It really kind of fell into my lap, right? So like as I mentioned, I grew up doing theater, music, and I really thought I was going to be on Broadway one day, but clearly my path of life took me to medicine, and even in through medicine, through medical school, I brought music back. I joined forces with another music-minded med student. He was a pianist, and we created a music group, like a musical enrichment for medical students group, and we put on little shows, seasonal shows. And then one of my mentors, actually, he had a band um, when I was in med school, and I sang with his band a couple of times. And then I created a band of us med students together, and we did again a few little gigs here and there. So we try to keep it alive. And then in residency, kind of fell to the wayside. Fellowship, didn't really have much time. But then as I got into practice, it was 2019. So Adrienne was 2018, and
Yeah.
I was 2019. I got a phone call from one of my mentors from residency. He's the drummer in the band, Nimish Nagershed. And I see the phone call. I'm like, oh gosh, what did I do? You have like the
Uh,
relationship with your attending when you're a resident, but now we're all attendings and stuff. We're all colleagues, but you still get those little feelings of like, oh no, what now? But so he reached out to me, said that the female singer that was with them when the band started, she left the band, and so they were looking for a female singer. And he knew I was the singer. He knew I was a musician. And so I went and met them up at the studio, and I sang a few songs with them, and that was it. And then I went on tour with the band that year. They had a few shows up along the East Coast of DC and Philly and New York, and it was really incredible. And it reignited this passion, this joy that kind of had been a little bit put on the back burner, right? I've got three little kids, and you're a mom, you're a surgeon, you're a doctor, you're partner to your partner, and then it's like you want to. It's having this creative hat, having this outlet. Really, it's something for yourself, and it just helps you um, reset, and in a very positive and uplifting way. And that's what I see. It's we're gearing up for our show this December. We have our band camp coming up in October. So we're all like giddy and excited because we're so, we're looking forward to just jamming together and being inspired by each other to make some new music and then get ready to perform. So it's really fulfilling, and I think we all need that in this field and in any other field where we're really fully like put a lot of ourselves into our work.
hmm Absolutely. And tell us a little about your event in December. It might be in New York City, so if Adrian and I are available, you might even be able to
yeah.
come.
Yeah.
Yes, you guys should come. So it's December 6th at the Cutting Room. It's in Midtown, so it's easy to get to. If if you're coming in from Philly, you could take the train down, and it's just Grand Central is right there. It's doors open at 7, and we usually go on like quarter to 8. It's gonna have a little bit of a holiday theme to it, so bring your Christmas cheer if you celebrate. But it's gonna be fun, and we'll do a lot of our original music that we always perform. We're hoping to have a couple new songs to share. But it's going to be great. We'll still, again, our whole purpose and focus is raising awareness for gynecologic cancers, right? So we'll have other organizations there supporting that mission. We'll have our survivors come up on stage to celebrate their survivorship and no evidence of disease. It's really just such an incredible show. Very lively. The venue is awesome. Good music, good food, good drinks, a good time. I think it's everybody who comes in and leaves, they big smiles on their face. Everybody's so happy that they made the trip and enjoyed the show. So
Well, that's great. Well, I'll check my calendar and maybe I can
yeah,
get some LinkedIn friends, some doctor
Yeah.
friends, right, to join us.
absolutely.
We'll take a look at that. And I will share how I met you the first time was, I had cancer 3 times in our local cancer support center. Ann's Place was pairing up with our local healthcare center, and they to sponsor they sponsored your band to raise
Yeah.
awareness, and they were looking for patients of both Ann's Place and our local healthcare system to come up on stage and you like have a poster board with the one side said what kind of cancer you had and the other side, what you've been able to do because you're alive. So I just had three cancers. So I had written, thyroid, and bilateral breast cancer, and I was just starting this work. I connected on LinkedIn, and April 2023. This was the summer of 2023. But I wrote on the back. I said because I felt a little awkward doing, standing up there. It's not my thing, but I was becoming a fierce advocate for doctors. So I'm like, okay, sometimes you got to do what you got to do. So I wrote on my poster board. Most people said I went to my grandkid's wedding or something like that. And I put, I'd become a fierce advocate for physician well being. And then after the show, I just went up to you because I loved your voice and I just thanked you and complimented you. And you had your little kid. I'm a pediatric physical therapist, so I love kids. And we just chatted. And I believe I said tongue in cheek to you, hopefully I'll only ever know you socially because I'd seen like 40
Yes.
doctors. And then then
No.
8 months later, I'm sitting in your office, right? You walked in and you're like, wait, don't I know you?
Yep. I'm like,
And
wait a
then six
minute.
months
Wait a
later,
minute.
yeah, 6 months later, you're taking out my uterus. But
Um,
anyway, but I'm grateful, very grateful to you. And if we pass it back to Adrienne for a minute, Adrienne, would you like to share some lessons you've learned from ballroom dancing that are helping shape your path forward in medicine?
Well, I think there's a couple things. One is I did kind of start this a little bit later in life. So I think that was one thing that was also very interesting for my patients too. So, pretty much it was my like fun fact on our website. And a lot of people, knew that I danced. And so, and like I was saying earlier, a lot of people assumed I danced all my life or danced as a kid and I didn't. So I think it was, being able for me to be able to share also with some of my patients that, you can start something a little bit later in life. It's very important and, helpful just for overall health and longevity to be doing something active and, whether it's dancing or some other recreational sport or just any kind of, fitness type program, the importance of that. I also have I've had a couple knee surgeries. One of my knees is fairly arthritic. And so I often also share that like, even if you don't have, even if you have a little bit of an injury or something that you're dealing with, your body's not perfect, you can still work through that. And, talking about also like non-operative things, even as an orthopedic surgeon, of course, we do a lot of non-operative treatment for things and how important that is and how important it is for arthritic joints, to keep them moving. So I think I was able to be sort of a good example to patients. And then for myself, understanding as I was getting older, because, I'm 54 now, I've been doing this for almost 8 years, and I want to continue to do it for many, many years to come. So, and, the way to be able to do that, of course, is to keep moving and to factor in other forms of, of working out, strength training and doing, good nutrition and all the things that we should all be trying to do as best we can, but, can certainly be hard depending on your situation. So it has made me look a little bit more closely at kind of the aging process and some other treatments and or things you can just be doing from a longevity standpoint. So I'm really diving a lot into that now in this career transition of mine also. And then the other thing was, I really again very much stepped out of my comfort zone when I first started doing this. And I have stepped out of my comfort zone again as I left my orthopedic surgery practice after I was 19 years with my group. And I left without another job to go to. So, and dealing with a non-compete and all of the issues that go, surround that. I didn't want to move. I didn't want to have a long commute to work. So I kind of opened my eyes to other possibilities and stepped out of my, comfort zone professionally for the first time ever, really, aside from when I first went into residency as a female orthopedic, resident, there's not many of us. And, I was the only one in my program, the first one. So I stepped out of my comfort zone way back then. But this really, is another time where, that analogy is there. Like I first went into the ballroom and I was like, I don't think I belong here. This doesn't feel right. But it's now become my home. It's now become a place where like, I can walk on that dance floor and like kind of feel like a winner and feel like I belong to be here. And it's sort of, it's one side of me. And then I have this other side of me. So I think, I think it just taught me about that, about stepping out of your comfort zone, but then also about, trying to do everything you can to kind of protect your health and wellness, kind of moving forward. And so much of that is tied to activity level.
Mm-hmm. Yeah, absolutely. So, Gizelka, if that brings anything to your mind, and then if you could go on to share a little more how N.E.D is, or N.E.D, I don't know if you like say the numbers or pronounce it, but
oh,
what the things that you're doing to raise awareness and money for gynecological cancers.
Sure. So I think music and medicine, I think it's very intertwined. I think it's kind of like the right side of the brain, the left side of the brain, right? And so I think it's really just helped me um, again feel whole, and feel connected to not just medicine, but to other aspects of my life. Um, with my patients, I think they're very excited when they hear about the music and the singing, and it's joyful. And so I think that's what I love bringing to the world of oncology, right? There's not a lot of people think of joy and happiness when they think of cancer, right? But then when your doctor is a singer in a band, it's like it's pretty cool, and then you have something to talk about. Or I get a lot of patients who will come find me because we have the shared interest, and they love that they can relate to me because they're also a singer, or they're in a band, or they play an instrument, and so we connect on. And I think so much of that doctor patient relationship is finding a connection, right? We've seen it over the years now, being more culturally aware, recognizing the bias that lives in medicine, finding doctors who look like you, who speak like you, who are of the same background as you, who have the same interests. I think that all of that has come more to the forefront, and we're seeing that helps patients feel more comfortable, and it also offers better care to them, right? When you come from a similar background or have similar interests, you can see things better, or you pick up on things better, and you recognize and can take better care of your patient. So I feel like that it lends itself to that, and so I'm grateful for that. With N.E.D, I like saying N.E.D, but
Okay.
N.E.D, it has come up. N.E.D head used to be, a thing. So with our band N.E.D, we collaborate with, or our parent organization is a Jazz Foundation for America. And so they are, so we raise awareness for GYN cancers, and any money that we raise goes towards that effort, goes towards allowing us to travel around the country, hopefully internationally one day, to continue to spread that message, to bring that joy to this world of oncology. Also, proceeds go towards the Jazz Foundation of America, which offers social support services, medical support services to musicians who are dealing with their cancer journeys, or with a debilitating diagnosis. So it's really wonderful where we're intertwined with the musician community, because we are musicians. We feel like we're doctors, but we are musicians. The group is incredibly talented. Every one of us are GYN oncologists, and two of the guys write all the music. I consider myself, I throw in all the flair and the extras, the additional melodies and harmonies, so that makes the music sound even better. But we're such a talented group, and so we really consider ourselves musicians, and so to collaborate with a parent organization that takes care of musicians at a vulnerable time in their life is very, very meaningful to us. And so that's a lot. That's, in a nutshell, the bulk of what we do, and where the money goes that we raise. So we're very, very happy about that, and very fortunate to be able to do it.
Well, I love that. I didn't really know those details, and I have had on a couple of physicians before, and we titled that episode Music and Medicine. So I fully resonate, and I've been in church choirs my whole life, and music is very important to me. So just thank you for what you're doing. And when you speak to connection, that's just 100% true. And I have to say that even, when you and I were talking before my surgery, that I had experienced a complication with my first surgery. So I was terrified of experiencing a complication. And I shared that with you, and you probably spent time. We had a Zoom like this, but not for a podcast.
Yeah.
And that answer my questions. It alleviated my fears. And just, it could make me cry right now, but just having a doctor that you could trust, right, and do something. But I knew that you thought it is what I needed, and I trusted you, and it's okay. And now there's a few other kind of cancers. Mine was, precancerous or heading that way, which
Yeah.
almost makes the decision more difficult than if it was. I was lucky that it wasn't already cancer, and
Yeah.
but just I have to thank you, and I'm giving you a shout out from the bottom of my heart, that it made all the difference. So
Thank you
thank.
so much. I feel very fortunate to be in this journey with you. I always feel honored when patients choose me. They could have chosen anybody else. So it's very, very heartwarming to me, and I feel very blessed to have patients, trust me to take care of them. It's very
Mm.
important.
Yeah, well, thank you. Then, yeah, that trust goes both ways, right? And Adrienne, would you like to share a story? Because I know you have some powerful patient stories as well.
I do for sure. I mean, I would say that what kind of really hit me the most, honestly, I mean, I was aware of it over the years. I had some, similar thoughts as far as like once it became a little bit more known that I danced, I also had, many patients coming in, especially like younger, especially in orthopedics, because there's not many females. I tended to have like my like college or high school age girls were often, more comfortable with a female surgeon. And then I started to get a lot of dancers coming through in that way, that were, very happy to be able to like have that in common with me, even if they did like ballet or a different kind of dance than I did, we could relate to that. And then I think, being in the same community for 21 years, I had the privilege of taking care of many families, generations of families, over time. And so, and it really, the biggest impact honestly came as I was having conversations with people as I was deciding to leave. And so it was, kind of a very bittersweet time, as I often describe it as both kind of heartbreaking but heartwarming because I wanted to make patients aware of, why I was leaving. Obviously, there was a lot of questions because I'd been here for so long. People are like, you can't leave. Like, well, what are we going to do without you? And I was part of a big group, and it's not like there'd be a shortage of orthopedic surgeons here to take care of people. However, just as you were describing, I mean, there's a certain degree of trust and connection that you build, you can build in a short time and you can certainly build over, over years. And so it was, there were many tears shed both on patient side and on my side. And sometimes I think I'm just an orthopedist. I mean, I'm not doing, work that's quite as impactful. I mean, I guess it
Oh
depends
no, you're doing lots of impactful work.
depends how you look at it, but nonetheless, I would often say like I'm not a life and death doctor, but I'm a lifestyle doctor. And then,
Mhm.
once again, like, obviously things we do and restore people's mobility and whatnot, I don't, belittle that, but nonetheless, I was almost a little bit shocked at some of the reactions because just the despair in people's, faces, like, well, what am I going to do without you? And it makes you really take a step back and say, I have done good work here. I mean, not that I didn't know it, but like, and I've made, like these positive impacts in people's life and they wanted me to know about it, and then people would be coming in with cards or even little gifts or even after the fact. And, patients have reached out to me since I've been gone. And even if they just want like a recommendation, they know I can't see them, but like who we trust you. So tell us, who in your group could see or whatever, because they need, they just need guidance. So I think, those relationships are so critical, which the work I'm trying to do now, particularly as part of what's called the Coalition for Patient-Centered Care, is an organization that is really trying to, once again, fight for the independence of physicians, fight for the physician-patient relationship, and putting the focus there where it should be, and really kind of, fighting against a bit of this like the corporatization of medicine, especially with this organization, and particularly with private equity, but just in general. And I think it's really a shame that we have to be fighting this fight to the extent that we are, but I'm putting all of most of my energy really into that now as I navigate my future here.
Yeah. Well, and thank you, Adrienne, for everything that you're doing. And as I mentioned before we started recording, I will be having on another doctor who's involved with the Coalition for Patient-Centered Care next month. So I'm looking forward to that. And what I wanted to say to you is no doctor should ever say I'm just a blank.
Oh,
Like in a
yeah.
way, I cannot even believe it. Like once I was going to have a pulmonologist on with a medical oncologist, and
Mhm.
and they were going to talk about cancer from different perspectives, and he said I'm just a pulmonologist, and I'm like, oh my god, like you're a critical care, like you were working during COVID, you separated yourself from your family literally for 9 months, you lived in the basement so you wouldn't expose your family to COVID, and you work in the ICU, like you literally save people's lives, so you can't say like just a pulmonologist. And also when people need orthopedic surgery, they're in pain and it affects, I'm a physical therapist, right?
Of
And
course.
it affects like you every single day of your life. So you do give people back their life and you
Yeah.
each do different things, but you're all, every single doctor is really, really important and never undervalue or minimize.
Mhm.
Well, thank you.
Yeah,
You're
no,
welcome.
absolutely. You said that so well, Kim. And that's really what I love about where I work right now is that all of us in the care team, all the doctors, we all play such an important role, and it's so important for the patient. It's all patient centered. That patient is in the center of that care team, and every single one of us needs to play our part, even if they're on their oncology cancer journey. The primary care, they're still engaged, they're still involved. The orthopedist may need to step in for one thing or another, the general gynecologist, even though they're seeing me, but maybe they need something else from them. So that's what it's great. It's that continuity, knowing that everybody plays such an important role in that patient's care and their journey. So definitely, we're not all just blank.
Yeah.
Absolutely. And speaking directly to that, I'll give the opportunity to give a shout to Dr. Andrew Ashikari. My mom was
Yep.
a patient of his dad and him for over 30 years, and that's how I ended up with him. And then it was his office when we had some concerns that referred me to you.
Mhm.
So it's all these connections, beautiful connections, and we're so grateful to have doctors that you're there when we need you. And I feel like we could talk all day, but I know you both have other meetings coming up. So as we start to wind down, Adrienne, is there any other messages that you would wish to share with your colleagues?
I just think for as much as possible, even if your situation is good, I think if you can, if you can get involved. I mean, there's obviously plenty of organizations, and everybody's busy. But I think we really need to, as physicians, to unite as much as possible. And I was just recently at an anti-monopoly summit speaking on a healthcare panel, and it was just it was impactful. And I think that there's a lot of work being done, and my eyes were open to that a little bit more, like over the past 6 months to a year. And I think it's important for us to like kind of get the education out to ourselves and then to our patients that we are really trying to kind of fight this fight and get control back. So I think physicians who are in maybe not as good situations, kind of like mine was, may be kind of thrust into it a little bit more if they choose, the way I am, like get out there and like speak up and speak out and kind of fight, because we can make a difference and try to really restore our independence. And I think those, if they have time, even if they're in a better situation, just lending their voice a little bit, or being part of an organization is still very helpful. And I think it's just going to take a lot of us and still a lot of work to get it back, but to get our like true, like again, quote unquote, power or independence back. So it's really kind of a passion, another passion of mine right now. So I think that's important for all physicians.
That's great. And you're also part of a group of orthodox who's trying to make some changes. And I know that you just were at a summit with them,
Yeah,
and that wasn't only orthodox either, right? So they can
right.
help and you can all work together to make things, yeah, better
Absolutely.
for doctors. So if people wanted to get in touch with you to find out more about how they can get involved, how would you recommend our
Yeah.
listeners get in
I mean,
touch with you?
really the easiest way is probably through LinkedIn. So, I mean, that's where I spend, kind of the most of my like, kind of social media time, if you will. And so I'm pretty active there. So, I just have, it's just my name, my personal like LinkedIn account is probably the best place to find me.
Okay, that's great. And Gizelka, do you have any final words for your colleagues and how our listeners can get in touch with you?
Yeah, so Instagram is where I spend most of the time. So G David West MD, or if you want to follow the band, it's N.E.D the band on Instagram. We have some Facebook stuff too, but I'm more active on Instagram. I think for colleagues watching, I think to echo the sentiments from both Adrienne and I, it's really getting putting yourself out there and being brave to try something different. I think Adrienne's story about really stepping away from her practice, it's very bold and brave. And I think there are many people who are in her situation. I know some friends of mine who really had a hard time and they didn't know or they couldn't step away. They didn't know how to. And I think it's so important to really prioritize yourself, right? And figure out what do you want? What does Gizelka, what does Adrienne want, right? And then how can you then lend your voice or lend yourself in other facets and continue to do the good work that you've always been doing, right? And so I think having those outlets, being creative, dancing, music, singing, instruments, art, visual arts,
Mhm.
anything, those outlets, I think, allow you to have a different perspective, have a different vantage point. And it also opens up your social community, right? I think in medicine, we're so much surrounded by other doctors, and that's something I love about, my family life and my husband and everything is his side of the family, there's like no other doctors. So it's like a totally different world of other people that I engage with. And so it's just nice to open up that social network and see other perspectives, other vantage points. And I think it really allows you to then kind of look at your situation and see how can is it fine? Is it great? Or are there ways to improve it? And how can I improve it? And how can I live better, live well? Because we all want that, right? And so we have to do it for ourselves first.
Yeah, absolutely. And that's so well said. So if any doctors out there struggling, pause, right? And there's always a path forward. There's plenty of people that will help you. You can reach out to any of us. And I just want to thank you so much for being my guest. I really appreciated this
Um,
conversation.
Thank you,
Thank
Kim.
you, Kim. Thank you for all you do as well. This is
Yes,
an
absolutely.
incredible
Oh,
organization.
you're welcome. So in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.